Welcome to Atheists Talk. I'm your host this evening, George Kane. Our topic tonight is the status of women's reproductive rights in Minnesota and in the nation. My guest tonight is Linnea House. Linnea is the Executive Director of NARAL Pro-Choice Minnesota. Linnea was brought on as the Interim Executive Director in June of 2007 and was hired as the Permanent Executive Director in May 2008. Prior to joining the staff, Linnea served as president of the NARAL Pro-Choice Minnesota Foundation Board of Directors from 2005 to 2007. She's worked in the reproductive health field for over 14 years, most recently with the Midwest Health Center for Women and Pro-Choice Resources. She served as campus organizer for NARAL Pro-Choice Minnesota while in college. Welcome, Linnea.
Thank you. Pleasure to be here.
So tell us about NARAL Pro-Choice. What is the organization?
So NARAL Pro-Choice Minnesota is an organization that has been around for over 40 years. Our base actually came from the faith community identifying a need that there were women who needed to have access to abortion care, understanding that they could receive that care in other states or in other countries, and actually started an underground of folks who were helping women receive access to that care throughout the country. So that was sort of where our roots came from. After the passage of Roe v. Wade in 1973, we shifted our focus from advocating for access to abortion care to protecting that right. In 1973, we saw sort of a shift that happened there. And then since then, that has been our main focus. Our mission is to protect and make sure that we continue to have access to a full range of reproductive health care options, including access to contraceptions, making sure that we have access to healthy pregnancies, and then, of course, having access to legal abortion.
So how big is this Minnesota chapter?
So the Minnesota chapter, we actually have about 16 staff here in Minnesota. We are very fortunate that we have a great state that really supports and understands why protecting a woman's right to choose is important. So therefore, we do have folks who as part of our staff, are organizing, going door to door, talking with Minnesotans in their communities, letting them know about the issues that we're facing in Minnesota, and then what our solutions are, and then asking them to join us. We are a 501c4 organization, which means that we do a lot of aggressive lobbying work, and you need to have a broad grassroots base to do that work. In addition to the folks that are going out and organizing Minnesotans about the issue, we do a lot of work also in our campuses throughout the state, making sure that young women are understanding what is happening. As people grow up in their small towns or even in their cities and they're going off to college for the first time, they're realizing that there are a whole host of issues that could be impacting their lives that they don't even know about. We really see that as an opportunity to make sure that women understand what's happening and then give them the tools to become leaders to take control of that. So whether that means, like myself on my campus, organizing a lobby day, understanding how I can become a more effective leader down the line, there's a whole host of reasons why we do that work. We also have a fairly new program that we call the Choice Leadership Institute and Fellowship. And this is really targeting young women and young men who do not necessarily fit the college. They're no longer in college or they never went to college, and making sure that we are also giving them the leadership skills that they need so that they can go back and advocate for the reproductive health and the reproductive rights needs in their own community. We really are excited about this program because I think it allows us to expand beyond sort of our normal base of folks who either come to us when they're younger or who have been around the pro-choice community for a long time. This is really getting that generation of people who are coming up who will be the long-term decision makers. We also have programs that are helping. We do some escorting at clinics, so making sure that young women, not necessarily young women, but women and their partners or whoever their friends are that are with them are having safe access to receiving their abortion care, that they are blocking them from the harassment and the other awful things that are said to them as they're going to receive their procedures. And then, like I said, the last thing we do is we do a lot of aggressive lobbying, and we do a lot of electoral work because we really do think that those things are tied together. So when I'm talking about advocacy, I'm talking about myself and staff people being at the Capitol, tracking every piece of legislation that we think that could actually impact a woman's right to choose, protecting what we have, and then where the opportunities arise, how we can continue to make ground so that we have more access to the things that we think that people need to be able to make the decisions about their reproductive health care. So we work on that at front, but then we also work to get those people who support our values and support the values that we believe that majority of Minnesotans have, get those folks elected through the electoral process, and then we also hold them accountable through our advocacy work. And so it's, we don't just like get them elected and let them go. We want to make sure that we keep them sort of with us and understanding why it's important to stand strong for women's rights.
You mentioned protecting women who are getting access to
Yes.
reproductive health clinics.
Yes.
Is that a real problem in Minnesota?
Oh, definitely. So if you, I'm sure a lot of folks have seen, maybe they didn't understand what was going on, but we do have, the majority of our clinics generally do have protesters that are standing outside of, whether it's a Planned Parenthood. We have one Planned Parenthood facility in the state of Minnesota that provides abortions. We have a total of 5 abortion providers in the entire state. 4 of them are here in the metro area, 1 is in Duluth. And all 5 of them have people who protest outside of their clinics. And in some cases, it's quite extreme. So we know of there's a clinic where the anti-choice side has actually gone in, bought the property surrounding the facility, have built deer stands so that they can have people that are sitting in the stands and actually look down on the parking lot and can yell things. So this is another form of tactic that we see people using. So it's not just something that, you see clips on the news and you think, oh, that's happening in other states. It's happening right here in Minnesota, and it happens in Minnesota every single day.
Just, I think it was last Friday, in fact.
Yes.
I was at the Planned Parenthood clinic on
Yes.
Vandalia and
Yes.
University in St. Paul.
Yes.
Right, and there was I'm not sure which group was larger at the time I was there. Our contingent was pretty large, but there were police there to keep there from being any actual contact.
Well, thank you for being there. It's really important that people show their support, and I know that oftentimes they don't think that showing their support for being at something like that really matters, but it really truly does, and it matters to the patients that are going there. It matters to the workers who face and cross those picket lines every single day. It matters that they can see at least once a year the community comes out and really supports them. So thank you for doing that.
I got the impression at this demonstration the opposition was entirely Catholic. I'm not sure if that was actually the case.
Definitely, I didn't actually make it this year, but I have been there in years past, and yes, I think that there's, obviously it's held on Good Friday, and so there's a reason why it's held on Good Friday, so it has a lot of religious overtures. I would say that a lot of the anti-choice or pro-life movement is driven by a sense of religion, and so I don't know if it's completely made up of Catholic organizations. I think there's a whole host of religious organizations that support that. But I do think a lot of it is driven by a religious perception of, oftentimes you hear like, God made you in the womb. There's lots of that language is used when they're talking about reproductive rights.
Right. Minnesota Atheists has a public policy position on reproductive rights. We're for it. We try to stay away from issues on which atheists can disagree, but we feel that reproductive rights is a topic in which the political discussion has been completely dominated by religion. And you'll find that not only Minnesota Atheists, but most atheist organizations in the United States, such as the Atheist Alliance of America, such as American Atheists, they have positions that take uniformly strong positions on reproductive rights, and it's because of our opposition to the influence of religion in the decision.
Well, it's definitely appreciated, and I think it's part of the mainstream. I mean, I don't think that most Minnesotans and most Americans, when asked at the end of the day, do you think that the government has the role to make that decision for a woman? The majority of folks are going to say no. And so I think that that's something that we all need to keep in mind. And it's important, I think. I'm glad that you've made that a part of your statement, because it's important for people to hear that and to know that it's not a radical idea, and it doesn't belong on the fringes, that the majority of people do really believe that women have the ability and should be the folks that are making the decisions for themselves.
Right. And I think you made an important point there. I'd say that an atheist or anyone can be personally opposed to or support religion for any reason, perhaps for secular reasons. A female atheist might say, well, I would not have an abortion. You understand that. But to maintain that the state has an interest
Yes.
in the life of a fetus, that is essentially a religious claim.
And I think that, so anytime we talk about, and for me, it goes beyond just sort of abortion care. There's a movement going on in the state legislature right now to repeal something called the family cap, which basically says if you are a person on welfare, if you have any additional children, those children will not be covered, which on its face is something that we are opposed to because we don't think that the government should be trying to restrict who has children based on what their income is. But there's also a piece in there that says, however, if you are a victim of rape or incest and you prove to the state that you have been a victim of that and the child is a result of that, then you can receive your money. And that little clause is something that we see oftentimes also in abortion things. And I don't think that the government has any place in asking anyone how a child is conceived. There is absolutely no business of whether it's a rape or incest. You should not have to prove to anyone why you either want to continue your pregnancy or why you want to terminate your pregnancy.
No, I think that could be very traumatic for a woman to have to
Yes.
drag that, that discussion
Yes.
into.
It's a clear violation
legal
of privacy,
yeah.
definitely. Yes.
Yeah. So tell us about some of the other challenges you're facing in the coming year with respect to the legislature.
Thank you for asking. So I just came from the Capitol today, so it's all very fresh in my mind. It's been the last decade or so in Minnesota, we've had some ups and downs. We clearly had a governor, Governor Pawlenty, who was pro-life, and those were his priorities. And we had some major legislation pass under his leadership as governor. For us, one of the most troubling one was a bill that would require a woman to receive state-mandated information about abortion 24 hours in advance of her procedure, which is oftentimes inaccurate information. It adds more burden onto the clinic and the facility and the physician that's providing the procedure, and it also on the woman. So causing delays, multiple trips, all that. Following the election in 2010, we had sort of a shift that happened. So we suddenly went from a pro-life governor to a pro-choice governor and Governor Mark Dayton to having a very anti-choice House and Senate. And so what we saw in both 2011 and 2012, 4 very egregious bills, in our opinion, passed in Minnesota that we're now seeing happening in other states. And if it were not for the veto of our governor, we would definitely have probably far more restrictions on women's right to choose in Minnesota had it not been for him. This year we've come back after the 2012 elections. We still have Governor Dayton, which is fantastic. We have a slim majority of pro-choice folks in the Senate, and we have what I would consider an anti-choice House. And all 3 of them are DFL controlled, but as people often have this assumption that if you're a Democrat, then therefore you are pro-choice, which is not obviously the case. But we are very thankful that we have more opportunities to get things done this year. So as an example, as the Affordable Care Act is being implemented, Minnesota just passed a healthcare exchange bill. So this MNsure, which is going to be a place for 1.3 million more Minnesotans can come in and buy their health insurance. What's been happening in other states is that the states have gone in and said, insurance companies, you cannot cover abortions within this exchange. In Minnesota, we were able to stop that from happening. And so we thought that was a great victory because we felt as you're going to expand access to health care, you shouldn't expand access to health care for everybody except for this one procedure. Again, the government has no place in deciding what kind of health care you're going to get. So we're very excited about that. However, that means that it's going to be harder for us to get other things done, considering sort of the mix of the House and the Senate. But nationwide, I would say, Minnesota followed the trend, except for our governor, which was fantastic. In 2011 and 2012, we saw a huge dramatic increase across the country of attacks on abortion rights in the states. It has been unprecedented what we have been seeing. It's been, and it's continuing. It's happening in our neighbor state of North Dakota right now. The governor just signed 3 outrageous bills that were written specifically so that it can go to the Supreme Court to challenge the Roe decision. And so I think we are seeing that it's not just, this is not an issue that's going to be going away anytime soon, and we're seeing that it's being fought in the state, on the state level a lot more. And so it requires us to be ever more vigilant and to be ever more cautious about what's happening and make sure that we stand strong on our principles.
I'm surprised to hear that the so-called Obamacare doesn't include any protections at the national level to ensure that the health insurance that's available for women includes
so that's
abortion coverage?
it's interesting because if a state chooses to have a federal exchange, then yes, there is some protection there. If a state chooses to have its own exchange, it can ban the restriction there. And so and there's also, I don't want to get into too much minutia, but there's also a clause in there that was passed that was sort of like the final deal that finally passed Obamacare when it happened in 2009 was the Nelson Amendment, which basically said that if you're going to have abortion coverage, that anybody who has an insurance plan that has abortion coverage has to pay for it separately from everything else. And so there's always this $1 that's going to be listed out that says that this is your abortion money. And so everybody, so whether you are whether you're an individual whose small employer goes onto the exchange and buys insurance, and you're a man and you are single and you don't have any, but your plan happens to have abortion coverage, you're going to have your $1. And so it adds a little bit more of a hiccup and more work on the back end. But we're confident that that's something we can work on in Minnesota.
And it's curious that one of the ways that Republican governors are demonstrating their opposition to Obamacare is their refusal to set up state exchanges.
Yes.
And insisting that the federal government therefore run it. When actually, from what you're saying, that is causing less of a problem for you than if they ran it themselves.
Exactly. And they're also turning down Medicaid funding, so expanding of health care within their states. And it's the problem, there's a lot of challenges and a lot of great opportunities with the ACA, the Affordable Care Act, but a lot of the states that have not as great support or insurance coverage for the folks in their states, they're going to continue, those folks are still not going to continue to get that coverage. So if you look at a state like Texas, which is still refusing to accept the Medicaid expansion funding or to set up their own exchange, it's difficult to see that those women and those folks are going to continue to be punished based on their income. And states like ours are going to be able to sort of maximize and do great things with it, which is why I think Minnesota continues to be a leader in healthcare reform, and we're happy that we can still be a part of that and not have people restricted.
I saw on your website that one of your organization's focuses is reproductive justice.
Yes.
Do you want to tell us something about that?
So reproductive justice. So there's actually 3 frameworks that are operating in terms of thinking about reproductive rights. And so you have reproductive health care, which is the folks who are actually the deliverers of the health care services. So that's a Planned Parenthood or a private abortion provider. So those are the folks that are actually doing the reproductive health care, or whether they're providing STI testing or prescriptions for contraceptions. There's the reproductive rights, which is the framework that my organization works from, which is really making sure that we continue to have the rights and doing the legislative work and the electoral work to make sure that those rights are protected and that we can expand them where we can. The reproductive justice framework really comes from a larger perspective, from a social justice perspective, and was really sparked by organizations that were traditionally not being represented either by the reproductive health or the reproductive rights movements, primarily women of color and communities of color. And so it takes a broader view about, we're not just talking about the right to choose an abortion, but we're also talking about the right to choose to have healthy children, the right to have access to health care, the right to have access to schooling. So it's a broader view, but it all fits in together. So I would say that we are still a reproductive rights organization, but as such, we definitely want to support reproductive justice movements and programs as best we can. And one of the things that we are doing is developing a project called the Trust Project, which is being led by women in communities of color here in Minnesota, identifying issues that specifically impact the communities that they come from. Understanding that that is not our field of expertise, but we're trying to give them the support and the tools to become good advocates for themselves so that they can become self-sustaining and not taking credit for the work that we're doing. So we just want to make sure that we are good partners in that way.
You had mentioned a moment ago that there were bills that were requiring things to be said to women that's actually medical misinformation. Could you give us some examples of that?
I don't know if it's actually, so when the bill was originally passed, it was called the Women's Right to Know Bill. There was information on their website that talked that there was a link between abortion and breast cancer incidences, which was, there was a study that was done very early on that everybody sort of, the pro-life groups really latched on to, that this was another reason as to why women should not be having procedures. All of that information has been debunked, and it's now no longer on the Minnesota Department of Health website, but for a long time it was. Okay. And we also have been seeing, not necessarily in Minnesota, but that doesn't mean it couldn't change, you know, that there's been the use of talking, even if a woman has coming to a procedure for an abortion procedure because she has an ectopic pregnancy or because she has a fetal anomaly, that they actually have to go through and describe what gestation the fetus might be and what kind of characteristics it's have, which seems particularly cruel for a woman who may have had a wanted pregnancy and needs to terminate it for reasons other than choosing to do so. And what we've been seeing in other states is that there, in addition to sort of having state mandated information, is the use of mandatory ultrasounds, and you probably have heard in both Texas and Virginia, it was the transvaginal ultrasounds. So really, you know, some folks have said it goes so far, you know, that the state is requiring that it's inserting something into your body that you may not want, and that's a pretty dramatic thing to have happen.
So what's the situation in Minnesota with crisis pregnancy centers?
Oh, fantastic question. So for folks who don't know, a crisis pregnancy center is a organization that's set up to, it bills itself as an organization that's going to help a woman who may be facing an unplanned pregnancy or an unwanted pregnancy, and provide them with the tools to continue their pregnancy and, you know, have healthy children. They provide free pregnancy testing, and they oftentimes provide ultrasounds. What we have found, though, oftentimes with these crisis pregnancy centers is that they come from a very religious-based perspective, and they often misinform women who are coming into their facilities not knowing that they're not actually a medical provider. They think that they are a medical provider because they often present themselves to be so. They are not. They hand out pamphlets that are oftentimes very religious-based and very shame-based. They are loaded with misinformation about pregnancy, about abortion, and will often use very manipulative tactics to convince women that they should not end their pregnancies or terminate their pregnancies. And in Minnesota, we have some of them that receive state funding through the state of Minnesota. So our taxpayers are actually being used to fund organizations that deceive, lie, and shame women for choosing abortion care. They also strongly discourage the use of contraceptives as well. And so we have lots of concerns about the practices being done by crisis pregnancy centers. And unfortunately, in Minnesota, like I said, we have 5 abortion providers, and we have over 100 crisis pregnancy centers in our state. And I think nationwide, the number is like there's 4,200. Well, I don't know what our numbers are, but definitely they are outnumbering legitimate healthcare providers and actually getting the information out to young people. And they often locate themselves on college campuses. A lot of them are in rural areas. And Yeah, we have major concerns about organizations that don't actually tell the public exactly what it is that they're doing.
So a young woman actually looking for an abortion might find herself being misdirected to one of these state-funded
Exactly.
crisis pregnancy centers.
Yes, and we know that is happening in Minnesota currently. They often will set themselves up right across the street from a facility. So we know that this is actually happening in 2 locations in Minnesota. There's probably more. So they have very similar names, and if a woman comes in for her appointment, they often won't tell her that she's in the incorrect place. There's a fantastic documentary that was made, I think in 2010, called 12th in Delaware. If anybody has any interest in watching it, we have copies of it at our office, and we're more than happy to share it. And we've done screenings of it. It's a fantastic, it does not have sides, but it just shows sort of the abortion provider and the crisis pregnancy center across the street and lets them tell their stories, and it's absolutely fascinating to watch.
Okay, we have a couple of minutes left.
Great.
I want to give you a chance to make a pitch to our audience, what they can do to help.
You know, we love folks to be involved in our organization and however it makes sense for them. So whether that would be going online to our website at www.prochoiceminnesota.org and signing up to getting our emails, giving a donation for the work that we're doing, coming to Lobby Day or calling us and saying, I want to be involved. How can I get involved and talk to my legislators? We're always looking for volunteers. We're always looking for folks to be a part of the work that we're doing. We have a great event that's coming up in a couple weeks. So on April 20th, we're going to be at Como Lake Park doing a 5K, run, walk, skip, however you want to get around. It's the Run for Your Rights, and this will be our 3rd year that we've done it, and we're very excited to see the community out there and support.
Okay, well, thank you very much, Linnea.
It's a pleasure to be here.
And I want to remind our audience that this is an important issue for Minnesota Atheists, as well as many other public policy issues. If you're interested in what our public policies are, please go to our website and look up our public policies. And throughout the evening, you've seen several times, I'm sure, contact information for us, both our web address as well as our postal address and our telephone number. And if you'd like to contact us and give us your email address, we'll put you on distribution for our weekly calendar of upcoming events. There are about as many atheist events during the course of the month here in the Twin Cities area as there are days of the month. And if you send us your address, we'd be glad to send you one issue of our newsletter, which is every month, packed full of information. So if you're interested in us, we're interested in you.